My name is Suzanne Phelps. I am currently a registered nurse in North Carolina and have previously practiced in Alaska, Oklahoma, and Michigan. I have been a nurse for 20 years and have worked in the emergency room, ortho, neuro, and general surgery. I am taking a class to earn my RN to BSN at the University of North Carolina, Wilmington. The class we are presently in is Nursing 398, which is health policy. This introduces the dynamics of policy and politics in nursing. Part of the class is to take a state-specific House bill and debate the pros and the cons with your classmates. Our small group has chosen the House Bill 88, which is the Modernizing Nursing Practice Act. The definition of this act is it allows the advanced practice registered nurse, APRNs, to work to their fullest potential under their nursing license and education. Included in the APRNs would be nurse practitioners, certified nurse midwives, certified registered nurse anesthetists, and clinical nurse specialists. These are already critical team members of our healthcare. One part for passing the Modernizing Nursing Practice Act is that APRNs are already doing the job. Insurances are paying the same for nurse anesthetists as they are for physicians to do the exact same work. Two, APRNs are doing the same job. The oversight that doctors are supposed to be giving nurses, their advanced practice registered nurses, are paying for this service for doctors that is being done quarterly, done by doctors most likely out of state, not daily as people think. One against passing the Modernizing Nursing Practice Act is doctors state that nurse APRNs do not have the same education. That's true. APRNs do not have the same education, but they're not asking to be doctors. They're asking to be APRNs that they are certified and educated to be. They are certified in primary care and have degrees in diagnosis, evaluating patients, and prescribing medications. As of February 14, 2017, House Bill 88, the Modernizing Nursing Practice Act, is in the Finance Committee for redrafting and rewriting. I'd like to make 3 points for passing the House Bill 88 Modernizing Nursing Practice Act. The first one is there is a shortage of primary caregivers in North Carolina. Advancing the Modernizing Nursing Practice Act would allow nurses to be primary caregivers. We have a shortage of primary caregivers due to the increased population, increased persons with insurances, the increasing age of the baby boomers, which therefore is also decreasing because of the baby boomer doctors are retiring. APRNs would be able to increase the health caregivers that are needed in rural areas. That is especially lacking. The second point is APRNs give quality care. Studies have shown that APRNs give equivalent, if not better care than doctors in some areas. They are increasing the health care to patients that are below the poverty level. The third reason is the financial impact that APRNs would have. First, they would increase the tax and revenue for North Carolina by $477 million annually. Passing the bill, financial impact would also increase the number of jobs available in North Carolina. APRN's education is less than doctors, and APRN's healthcare has shown in studies to use less resources per patient. I believe the Modernizing Nursing Practice Act should continue on to the Senate and on to the governor for passing. The Nursing Practice Act has not been updated in more than 40 years. It is time for the Modernizing Nursing Practice Act to change with our healthcare needs. APRNs are leaving their jobs in North Carolina and living in other places so they are able to practice to their fullest potential that their education and knowledge allows for. I do believe some changes need to be made to the writing of the bill to state the definition of the education that is needed for APRNs and having a state-mandated test and board certification for nursing. Advancing nursing practice registered nurses are already doing the job of doctors. Let them get the same recognition and credentialing that they deserve, release them from the unnecessary restraints, and pass House Bill 88, the Modernizing Nursing Practice Act.